How's things been over the last couple of months?
I think initially for us it was a bit, well, I think for everybody it's probably been really reactive, wasn't it? And I'm quite impressed with how reactive we've been able to be and how quick decisions have been made. And that shows that we can actually make decisions quite decisively and effectively and transact stuff quickly, which makes you then think, well, why have we taken 4 years to transact something which has been needed, such as MS Teams, for all this time? So if a decision can be made under such drastic circumstances, why has it taken us 4 or 5 years to get MS Teams up and running, which would have saved the trust and us a lot of time? So I think, it's quite impressive what we've been able to do under such circumstances.
I think there's some learning to come from that, isn't there? But just thinking back to those early days when we first started with this, I mean, it was just new to everybody, wasn't it? So, we had the uncertainty about PPE, about risk assessments, and just thinking back to those days of managing all that staff anxiety around face-to-face interaction with patients, that there was a lot of anxiety, in particular on some of the wards. In the early days as well, we had quite a high rate of infection, didn't we? On some of our wards anyway, with some of our patients. And on one of our wards in particular, there was a high rate of positive cases among staff. So there was lots of anxiety around then, and not helped in the early days, I don't think, by the ability to sort of mobilise around PPE and the guidance changing almost daily, really.
Yeah.
But I think that's really come round now. When I talk to staff now, I think they welcome how we've managed the PPE in particular. They feel really supported around that, which is great.
I think, and I think for us in community health services, we had a bit of a double whammy of COVID-19 coming along, as well as building a new team. So we had to calm the chaos quite quickly and connect with one another quickly as well, to get to know each other. But I think the teams have absolutely united and connected. And for us, through the conversation and picking up the phone, and I think we've, irrespective of whether we can see each other face to face, we've conversed a lot more, and we feel that we've got to know each other a lot more through that conversation, rather than email trails or text messages. So for me, from a very early start of probably not knowing the team greatly, and then the chaos of whatever COVID-19 threw at us, actually through conversing and connecting probably on a daily basis, not only have we calmed the chaos, we've transacted, as you said, Adele, quick decision making and defensible decision making. But I think we know each other as a team more than we would have ever known each other as a team. I think we're in tune with each other a lot more to support each other through what the next chapter of the COVID-19 throws at us.
I think it's been a success story for the trust, really. So, I mean, in talking about community services, so, in those early days, again, we had all those challenges. How do we maintain essential clinics? How do we deliver medication? So from the staff on the shop floor all the way up to support services worked really well together to find solutions to that, and get the solutions and get the communications in place. I think it's been a real pulling together exercise actually for the trust. And I do think back to our previous staff surveys, and I think there's been a lot of healing around our trust and the workforce, and the sense I get anyway of talking to people and recent surveys that we've done, that they do feel we've worked together well as an organisation.
Yeah, I think externally as well. For impact for us, we obviously opened Nightingale, and our patient came from Impact, so that's shown that that provider collaborative has actually worked for us, and we put that into a place quite quickly when somebody was poorly. some of the different ways of working. Obviously, we had the Chatsworth staff come across and help us at that point. So we've used healthcare staff from the physical healthcare team to come and support us with that. But also our staff here have found a different way of working with a low secure patient in a high secure facility was a real challenge for some of our staff. But they did it really, really well. And, we've got to be proud of what people have done in such quick circumstances and quick changes they've made, and really professionally as well.
Absolutely. I think listening and having chats with the staff who have been involved, I don't think we would have ever had those opportunities of experience for us staff. And listening to chats with staff who have been on the Nightingale, they've really rose to the challenge in such a flexible way and actually enjoyed the opportunity that it's given them. And I think likewise, some of us clinicians in reaching into MESOP in the early days around that palliative care patient, they've really enjoyed that opportunity. And I think that's something that they want to retain, that kind of professional advice and support to one another across the divisions in their areas of expertise.
That's what we were trying to do in the first place, wasn't it?
Absolutely. And for me, kind of when in the early days, picking up the phone and translating what the national guidance was saying, I know I picked the phone up to Chris and we were like, oh, what does this mean for swabbing? What does this mean around PPE and sessional use? And just bouncing ideas off each other has really helped kind of translate it and help the pace of the decisions that we need to. And I don't think we would have ever picked up the phone or had the chats if we weren't in a pandemic, but actually how do we sustain it?
Yeah, I think a lot of people have sort of dug in and put themselves out, haven't you? I think about people who were redeployed, I mean, thinking of that anxiety, going to work in a strange workplace, especially if you haven't worked on an inpatient ward for years and all of a sudden you're redeployed from community to inpatient. But, actually, I think a lot of people have found that positive, and a few I've spoken to want to stay on the placement that they're on now. So, and that's great, actually, for sharing experiences and seeing things from other people's point of view. So I hope we can maintain that as well, actually.
Yeah, and Chris, that's something that some of our staff have said, actually. We've done it in a reactive way around deployment. How do we keep this going as rotational and provide some opportunities to flex across services? So if we do it another incident or pandemic, that we're even more prepared than actually we've benefited from the flexibility of the staff in COVID-19.
So in terms of changes then for your services, how much has changed, how much stopped? Because we didn't actually stop that much, actually. We stopped a few services and had to redeploy staff, but for the most part we've maintained all of our services, albeit with much less face-to-face in community, which is something we need to get going again. But our activity is maintained. Again, that's mainly been by telephone, but we haven't really had to stop much in way of our service delivery.
I think for us, we changed the way we worked. We didn't stop loads of stuff, but we've prevented people such as like psychologists, social work, going to the ward to reduce the footfall. But MS teams came in quite quickly, and we started doing therapy and stuff with the MS teams. Obviously, that's had an impact on our nursing colleagues. Because they have to sit there with the laptop with the patient because of the security restrictions, but we've still maintained some of that. I think the biggest impact, which has been fed back from patients daily, is that the therapists and education staff went to work on the wards with the nurses, and the increase in activity for those patients who are really hard to reach and hard to engage has massively increased, and those patients are now wanting to access therapies and education facilities. So we're doing a quick review of how that's impacted and what we can do to try and do a mixture of both those services. It's the patients have just raved on about how brilliant it's been here, so we've got to take that on board of that, and the TED and nursing staff have said about that being a really good collaborative way of working.
Absolutely. I think we're in a similar boat in community services. While we had a very prescriptive national guidance of what we should partially stop and continue, kind of we've continued but transformed the way that we've delivered. The only particular services that we've stopped is due to a national request, for example, pulmonary rehab. But over time, we've converted that to virtual mechanisms around IT and digital approaches. I think the other element that we're trying to now recover quite rapidly is school age vaccines outside school footprint before it becomes a public health issue, and kind of the team are thinking creatively how they can continue doing that programme up and over summer holidays, so we don't have that issue that'll loom in September if those children aren't protected. And likewise, as therapy services, we've had to threshold those urgent needs only. So those lower level needs, whilst we've maybe done some virtual mechanism with us, they could potentially be deconditioning because of lockdown around functional decline. So as therapists are thinking, how do we sustain discharge to assess? But actually, if we don't bring back online community therapy quite rapidly, those patients and cohorts of patients that are not getting seen at a lower level will have increase in urgent need and will become a discharge, and it'll be an avoidable admission. So we the therapists are kind of thinking how that will impact on the services and recover outside of national guidance really before phase 3 letters implemented, and just getting ahead of the curve. But the clinicians are driving the agenda.
I think we've had, we've done quite a lot of surveying of staff around the changes and had lots of feedback, actually really useful feedback, and there's a lot of positive messages about working from home and video consultations, especially if they can get the technology side right and stop it dropping out, get better reliability. But, so they appreciate that, I think, the staff. I think they've appreciated not having the, I guess what you call bureaucratic, demand on time, and hopefully we can maintain that. I think we need more in our services actually in terms of the patient voice. I think that hasn't come through. It's dropped off the responses for patient voice during this time, so we need to get a better appreciation than that. But I know for carers in particular, it's been really tough, hasn't it? We rely on them so much on a lot of our community services, but they've not been able to, interact with families, etc. So it's going to be interesting to see what their views are in terms of going back. I just think there'll be a lot of people wanting to get back to face, but also people worried, and anxious actually about having face-to-face interactions again.
For our carers, we did our first virtual carers event a couple of Saturdays ago, and we had people who attended that who wouldn't have been able to attend a face-to-face one anyway, because obviously we've got national services, we've got people from Ireland and stuff. So we had people attending that online, which was absolutely brilliant, which we wouldn't have been able to have before. So there is something about technology and the place for it, isn't there? And a mixture of both. So I think we started some virtual visits as well, which we've been wanting to get in, especially for our deaf patients, which is a national service. They're able to use the sign on the screen, which is we've been trying to find a system to be able to do that for many years, and we're just in the middle of piloting that now. So there's been some brilliant advantages to this as well.
Absolutely, totally agree. I think having conversations with the teams out there, I think one of the nuggets of COVID-19 is the agile working and working from home. And I think at first there was some concerns around losing the connection with the trust, but actually people have found their colleagues to be more responsive, because they are at the end of a button to have a conversation with and support, so they feel kind of still connected. And I think there is that balance, isn't there, of how do you continue to be connected over the longer term, because people will pull together over the shorter term because we are in such a precedented time. Can we sustain that, and what does that mean moving forward around remaining connected for the workforce? I think some of the complexities that we've found with virtual working is around those clinical judgments. around when our workforce are having to make judgments around the dynamics in the room, especially safeguarding strategy meetings or safeguarding agendas or new parental visits from a health visitor perspective. And likewise, we've seen a change in accessibility to us services, so people have chosen not to be admitted into the hospice because of the visiting schedule and chose to care for their loved one at home. So I think we have seen some changes in how patients prefer to access and make decisions around the care, and it'll be really interesting to hear those stories coming through as we move forward.
There is a bit of a disadvantage to this, is because we can you can just click a button
and say goodbye.
You definitely can't shield it. I don't know about you two, but I've been much more because we haven't got that travel time, or you're putting that time in your diary. I am much more busier, because actually you're just filling your diary up all day long. So we haven't had much thinking time, I suppose, because MS Teams, you can go from meeting to meeting to meeting, and I think for us there's something we need to think about, of having a bit of thinking time rather than just put it in a
that is a good point, isn't it? Because we've gone from when COVID struck and all of that uncertainty and mobilising to now all the pressure to recover and restore all our services. So the workforce and just hasn't had a break, really, has it?
Not at all.
From all the drama and emergency to now we need the planning and moving forward.
Yeah, and every service is trying to go back to normal. So, your commissioning services and things which were on hold, everybody wants to go back to normal now, but we're trying to restore as normal services. Yeah. And I think we need to have that time to be able to support our workforce to reflect and think about things which has been positive for them and what they'd like, what we've learned from it, but also us as a senior team, or even in his own hubs, to have a bit of thinking time. Yeah. Because we're just constantly on reactive mode again, which I don't think's always a good position to be in. We need to be able to strategically think about what we need to do for the future, and I don't know whether we've got that thinking space tank.
No, and I think it is about our etiquette, isn't it, and remembering to press his pause button.
Yeah.
Because it is important to press his pause button, because you do need that headspace, else we're going to do that. Press pause to think around what's the next agenda and how it's going to play through. But it's important to tell the teams that to press pause as well.
Yeah, definitely. Yeah, definitely.
Class.
Right.
All right.
On that
note, we'll press pause.
Pause. My next Microsoft Teams meeting.
The next meeting.
No.
Take care, guys. Bye.
See you later. Bye.